KITAJIMA. Today I'm going to talk about iPS cell. My theme is iPS technology makes people live longer in the future, merits and demerits. First, I will talk about the situation of medical care. Look at this photo. This is Susan Liu. She tells us on TV that iPS cell is a solution for this problem. She went to prison to get organ from prisoners. It's very terrible things. Susan Lim is a Singaporean surgeon who performed the first successful liver transplantation in Singapore in 1990s. This is a graph of organ transplantation. Orange line is waiting list for organ, and red line is recipients, and blue line is deceased donors. The people who wait to the organ transplantation is increasing year by year, but the donors is very few. So many people were died year by year. It's sad things. Susan Lim thinks that iPS cell can change the situation of this medical care. So what is iPS cell is the second theme. This is a background of iPS cell. Until now, iPS cell has been existed in the fields of science by destroying a fertilized egg. However, breaking fertilized eggs is opposed to ethical and religious problems in the world. Then, it is difficult for scientists to make iPS cell. iPS cell was found that need not destroying fertilized eggs. This is the photo of a mechanism. iPS stands for induced pluripotent stem cell. iPS are adult cells that have been genetically reprogrammed to an embryonic stem cell-like state by being forced to express genes and factors. The mechanism is put out the somatic cell from skin and put several genes to the somatic cell, cultivate the somatic cell for a few weeks, iPS can be made. Third, next is merits and demerits of iPS cell. First, I will talk about merits of iPS cell. Do you know what can we do with iPS cell? There are 4 things to do iPS cell. First is regenerative medicine. iPS cell will be able to make organs from cell of human skin. It can solve the situation of decline for donors to do organ transplantation. To research about the cause of disease, by making iPS cells from the cell of patients who have some diseases, we can research what kind of disease and causes. For this research, we can do more exacting care, and it uses for medical care about example of disease. 3 is new drug development. We can do clinical tests with organ made by iPS cell. This is an immense power for new drug development because not carefree for a side effect. So toxicity test can be done with iPS cell. 4 is allergy reaction. iPS cell is different from ES cell because it doesn't occur the allergy reaction. This is a 3 new drug development. This is a regenerative medicine and making clone mouse. Next is a most developing experiment of iPS cell. Age-related macular degeneration is the most common cause of visual impairment in the elderly and affects up to 1% of people over 5 years of age in Japan. Currently, available drug treatments for this disease focus on inhibiting neovascularization but do not repair damage that may have already occurred prior to administration. This is used in Kobe University. Ministry of Health recognized a clinical test with iPS cell for human in June 26, 2013. This is an age-related macular degeneration-oriented test. The mechanism of this test: pick up cells from the patient's skin and grow up to make eyes. Finally, doctors change a new retina from diseased retina. This is some demerits of iPS cell. The most demerits of iPS cell is occurring cancerous. In the process of making organs from the iPS cell, tumors may develop. Using iPS cell to the mouse, 2% of chimera mouse become cancerous. This is a photo of chimera mouse. This is a tumor occurred. There are 2 causes of developing tumors. 1. Cancer may appear when genes are damaged in the process of the reprogramming factors being put into cells. 2 is a parasite species called teratoma may be formed when removing the undifferentiated cells. There are many ways to avoid making cancer. Professor Yamanaka found that LMYC is a second cell to the CMYC. It can reduce the rate of making cancer and increasing the rate of success of making iPS cell. Professor Yamanaka joins to Kyoto University. Third is ethical problem. Second is ethical problems about iPS cell. The way of making ES cell is against the ethical and religious problem for people, but iPS cell is solve this problem. However, iPS cell can occur the cancer in all over the world. People who believe that the ethical and religious things think that iPS cell is better than the ES cell because it doesn't need a breaking embryo. Breaking embryo is against the ethical problems. In the contrast, scientists said that without ES cell, the technology of science will not be developed in the future because there are many people living in the world. If iPS cell will be developed, it can make the clone people. This is against the ethical problem. The professor of Tenri University said that making clone people connects to making baby between same sex. This is my conclusion. APSL is very important cell for medical care. If it will be developed in the future, the life of people may be longer than now. Organ transplantation is an example of this field. Now, iPSL is going to use in medical care in Japan, but there are some demerits for it. Making cancer can avoid with developing science, but ethical problems cannot solve easily. In order to relieve the religious problems, you should do overthought to recover in one's mind. Thank you for listening.